Hello, my name is Khosla and I'm a medical student at SUNY Downstate. Today I'll be presenting our work, The Role of Oxidative Stress in Age-Related Lower Urinary Tract Disorders, a Systematic Review. I did this work with Susan Gong, Dr. Jeffrey P. Weiss, and Dr. Lori A. Bladder. I would like to thank ICS for allowing us to present our work. I have nothing to disclose. I will begin with some background for our research. Over half of adults have experienced LUTS symptoms leading to many disorders, with prevalence expected to increase by at least 18% in the next decade. With the percent of population aged 65 plus increasing, as shown in the figure, evaluation of these mechanisms of the disorders becomes more important for management and treatment in the aging population. Age-related LUT disorders are linked to ischemia, inflammation, and physiological changes. These factors are connected to aging through oxidative stress. Oxidative stress, in turn, increases due to mitochondrial dysfunction in the aging population. The goal of the systematic review was to evaluate the relationship between oxidative stress and age-related LUT disorders with the aims of A. Summarizing evidence on oxidative stress in studies characterizing age-related LUT disorders, B. Analyzing common manifestations and biomarkers, and C. Identifying future areas of research. I will now discuss our methods. The systematic search was conducted in March 2021 to extract results from the databases listed. Inclusion criteria included studies published between January 1, 2000 and March 1, 2021, evaluation of oxidative stress and LUT disorders, investigation of age-related LUT disorders, preclinical and clinical studies, and assessment of results by appropriate statistics. This figure shows how we sorted articles. The search gave a total of 882 results. After removing duplicates, 758 titles and abstracts were screened. Exclusion reasons are listed above. 712 articles were excluded. 46 full-text articles were screened. 25 articles were excluded because they focused on primary mitochondrial defects, had insufficient data, were narrative reviews, or for a reason not previously described in title abstract screening. We included 21 studies in our analysis. From the 21 studies, we extracted and analyzed data on sample characteristics, study characteristics, lower urinary tract structural and functional changes, and changes in molecular biomarkers due to oxidative stress. Study quality was assessed using the grade criteria for all studies and the OCEBM criteria for the clinical studies. The results of the 21 studies is as follows. This table summarizes the 13 animal studies we included. These studies were published between 2003 and 2019. The sample sizes ranged from 12 to 54. The animals investigated were either rats or rabbits. The age of the animals ranged from 2 to 18 months. All studies were experimental, that is, they conducted basic science experiments on the animals. The duration for investigation and data collection ranged from days to 1.5 years. We also included 8 human studies. The studies were published between 2003 and 2019. The sample size ranged from 25 to 79 patients. The sex ratio varied from 100% male to 100% female for these studies. The age of the patients ranged from 42 to 86 years. The mean age ranged from 42 to 66.4 years. There were 4 case-control studies, 3 prospective cohort studies, and 1 experimental study. The data collection period ranged from days to 2 years. Here we have the results for quality assessment of all studies using the grade criteria. There were 5 low quality, 11 moderate quality, and 5 high quality studies. For the OCEBM criteria evaluation of human clinical studies, we found 3 studies to be level 2B and 4 studies to be level 3B. The disorders evaluated in the studies are listed. Common structural changes included increases in prostate weight, stromal thickening, ischemic damage, trousseau hypertrophy, and increased collagen deposits. Common functional changes included decreased bladder contraction, perfusion, and voided volume. There was an increase in bladder sensation, detrusor excitability, inflammation, and voiding frequency. Variable uroflow changes were also noted. This table summarized the general trends for the biomarkers investigated in the studies. In summary, the biomarkers showing increasing trends in the disorders are noted above. These include a variety of molecules and receptors. Biomarkers that decreased include M3 receptors, TAC, NOS, and SOD. NERV2 showed unclear trends, increasing in PBOO but decreasing in IR. I will now present our conclusions. There is a strong role of oxidative stress in age-related LUT disorders, as noted by the common structural, functional, and biomarker changes. The changes can be categorized as evidence of damage caused by oxidative stress, mechanisms to protect against oxidative stress, neural changes, and inflammation. Some limitations are noted in the slide. The first two limitations lead to a lack of studies. In addition, some biomarkers didn't have multiple studies, leading to a weaker analysis of the trends noted. In the bigger picture, we should see the biomarkers described and analyzed in this review as a potential method of improving prognosis and treatments of age-related LUT dysfunction. For some biomarkers, further research is needed to help characterize changes in both controlled and natural settings. Nevertheless, this review should show that there are complex interactions in play between oxidative stress, inflammation, and neural changes that can lead to major changes in the lower urinary tract. Here are our references. Thank you for listening, and thank you to the ICS for this opportunity.